Hi guys, this is Joel again, and I'm going to narrate this video utilizing a flapless technique with the AnyRidge implant and the X-Beat surface. One thing I want to point out as far as your flapless technique goes, you really want ideal conditions when doing a flapless technique. The reason I started here with this video, or rather with this picture on the video, is because when you're placing the implant flapless, guess what? You can't see. All right, so there's a beautiful picture of why the flapless technique is actually a little bit more difficult, okay? Because you cannot see the underneath bone, you can't see the irregular architecture. For instance, if you have at the coronal portion, you can't see any undercuts that you may have, you can't see any voids, for instance, that you may have in the bone, even though you have a CT scan. A lot of that stuff, it really is not verifiable until you get into the bone itself with your drills. So flapless technique, again, is not that simple. You really want ideal conditions before you start your flapless technique, and so that's something to be evaluated beforehand. All right, let's start the video. All right, so again, posterior molar, lower left-hand side, posterior molar area. Obviously that bridge was removed. And all right, there you see your tissue punch. Your tissue punches are handpiece driven, which is very, very nice, because your hand tissue punches are just too difficult to use in the posterior due to access. All right, so again, the contra angle aspect of your tissue punch is very, very nice. And by the way, there's a black mark on your tissue punch kind of showing the depth. Now your tissue punches do come in a 4, 5, and 6 millimeter or small, medium, and large sizes. Oh, by the way, notice that sort of beveling or rounding movement with your tissue punch. That is to make sure that all aspects circumferentially of the tissue, of the punch of the tissue, are removed. All right, now one little trick to point out is, before I proceed, that tissue punch that you removed, take that tissue punch out and measure it with a perio probe. Okay, that is going to tell you how deep your tissue is, obviously, and how deep your implant placement it will be to be able to reach the bone level or the crestal level for your implant. But again, with the AnyRidge implant, you're going to place these about 1 millimeter subcrestal, or you can also place it bone level as well. We'll go into that in just a second. So there you see your Lanch drill being utilized. Excuse me. And your 2.0 marking drill. Next. Notice that we are using the marking drills in the posterior due to access. It is easier, notice that right there. It's easier to use your long marking drill in the back versus your short stopper drills, because you would be hitting your teeth here in the anterior, and then your alignment would be off. So again, it's easier to use your long marking drills in the posterior if you do have the access when you're doing flapless. Okay, your next osteotomy, now the implant's going in, and again, this is why. Let me stop it right there. Again, 1, 2. So the tissue typically is about 3 millimeters deep, so it should be right about here relative to the placement of the implant. All right, there. Now let's stop it right there. Look at the healing abutment. Obviously, the healing abutment was placed. Look how high the tissue is circumferential to the healing abutment. Now let's look at the final picture here. Beautiful placement, by the way. All right, let's get a little bit closer. Good. Your implant is bone level. Okay, so that's nice. It's a 4.5, looks like by about 11.5, or even, yeah, about 11.5 implant. So 4.5 by 11. And look at your healing abutment. It comes up nice. And here you can see in the X-ray, you can see the height of tissue. Remember, we just showed you the height of tissue. The healing abutment top was the only thing showing. So that shows you how thick your tissue is right there. And again, what you could have done is when you did your tissue punch, you removed that tissue punch portion of the osteotomy here, and you measure it with your perio probe before you proceed. So don't throw that little tissue punch away, because that's nice. So you can measure that, so you can know exactly how deep to place your implant to reach the crestal bone level top. Okay, but again, your handpiece, if your handpiece adapter was in here and into in the X-ray, here would be your 1 millimeter mark. There would be your 2, and there would be your 3, right at about tissue level right there. So that's what those markings are in there for. So where you can see if you are doing flapless, you can see right about your 3 millimeter mark where your implant level would be bone level. Okay, as you can see, it's bone level. So if your implant was 1 millimeter subcrestal, the mark on your handpiece adapter would be at 4 millimeters. So again, now you see what all those marks on the handpiece adapter are for. Specifically, again, for flapless technique, as well as implant placement, to exactly see how deep your implant is relative to the bone, whether it's crestal or subcrestal, and again, relative to your tissue depths. So you've seen, there you go, that's that video. Now let's play it one more time all the way through without interruption. Okay. Tissue punch. Notice that sort of wobbling movement technique. Take out your tissue, measure it. Long aspect of the drill, longer aspects of the drills for access. Yep, looks like you drilled it out to about 13 to the top of the tissue. Yep, 13. Implant it going in. They're not going to show it, but you will see the healing abutment in place. There you go. And it all the way down. All right. So that was that for flapless technique. This has been Joel Gonzalez again at joel.gonzalez@megagenus.com. Email me if you have any questions. Have a good day. Take care.